the COVID test, but since March of 2020, we've done 14,647 tests. Last week, we did 266 tests. So these are on all incoming inmates, arrestees, and transfers, and anyone with suspected COVID, we test. The number of positive confirmed inmates in jail custody at that point in time on April 14th, we had 3 at the main jail and 4 at the branch. These are down to the very low beginning phases of COVID. When I looked at our census today, we actually have 3 at the main jail and 0 at the branch jail. So this is a stark difference from when we were in the outbreak mode. For the vaccination of inmates, as of last Wednesday, we had vaccinated 1,191 inmates. Of those, 90% were fully vaccinated, and that's using both the Moderna and the Janssen vaccine. When we report our data today, we'll probably have less inmates because of the Janssen pause in the vaccines. We've had a lot of inmates refuse any type of vaccine since that pause came out from the feds, including Moderna, because they were already reluctant, because a lot of these are young, healthy males. So they just don't feel the need, and especially with that pause. In terms of staffing, we've provided, this is as of last week, we provided 803 vaccine doses, and I think that was about 400. I just did this earlier today. I can't remember what the number was. I think it was 400 some individual staff were vaccinated. So we have those as well. And those don't include, looks like total staff were 412 unique staff. 398 are fully vaccinated, which is about 96%. Those don't include our mental health staff that have been vaccinated by UC Davis, and it does not include staff who receive vaccinations off-site. To date, when our monitors get our data, they've been very positive about our confirmed cases. I've received compliments from our monitors, both the medical and mental health, on our vaccination efforts and programs. They, as everyone is, we are a little bit dismayed by the Janssen, because that was a vaccine that was much more widely accepted by both inmates and some of our sheriff deputies. They prefer the 1-dose Janssen. So those are our efforts on the COVID front, which I think we're doing well. I hope it continues. Our main mitigation, obviously, is the vaccination process. If we are to have a small working group, rather than start with the data, I think we need to really start with what is the remedial plan, what is the consent decree, and some of the efforts we are doing. Some of the data, like the QI data, is similar to what you would do in the communities. Many of us that work in the jail are familiar with that. We don't need outside expertise on having that committee. It's just our bandwidth of doing this all. We are required, as part of some of these practices, that as we complete a practice, that's when we look at some of these data elements. So not all data elements are going to be rolled out at the same time, just like all practices are not rolled out at the same time. But I just wanted to share that part as well.
Yeah, that sounds good. I don't think we were assuming that you didn't have the expertise. It was more, our concern is the bandwidth, whether you have the resources, and bringing in consultants would possibly alleviate that strain.
Yeah, it's really the magnitude of some of these changes. And I could probably go over one with you that I have. In order to look at our ADA practice, we actually wrote 5 policies or 5 practices that we had to do. We had to change all of our electronic data reporting, which we're doing. And then we're doing facility-wide training on that. So in the remedial plan, it looks like you're supposed to have 2 policies, but what we ended up doing was 5, plus all of this electronic health record work. Then we had to do training tools, and then we have rolled out to like 140 staff. That's on one item. So each of them, and then as soon as we're going to start doing some QA on that, and that's what we'll be recording and looking at how that's rolling out for the nurse intake. So each one of these elements, which may be one item in our remedial plan, requires kind of a host of efforts.
Okay, I appreciate that information. It's good to have an understanding of this.
Sure.
I want to interrupt for a minute. We do actually welcome Annie and Joful. We have a quorum now. So I'm going to take a pause here from our discussions with Sandy and turn to the issue of the vote for, we have Brian Jensen here who presented on the emergency medicine that program, the assessment and the suggestion of how to fund that the county needs to find some funding for this program. It was a very thorough report and a very thorough presentation. We thank you for that. There weren't any questions at the time. I don't know if people here present today have any questions about the proposed, about the recommendations to the Board of Supervisors that were proposed by the Emergency Medicine Advisory Group. If you do, I'm sure Brian is willing to answer any concerns. And if we don't have any questions, I would propose we vote. Yes, Steve.
Okay. I'm not on the board, but as a public person, Brian, I'm curious about whether in your presentation to the board or your proposal, whether you spoke about specific funding sources that are different from the current.
We addressed that. We've spent a lot of time working through what potential funding sources could be. And frankly, it turned into an exercise of basically a process of elimination. We identified a bunch of things that are potential sources that other counties or other LEMSs use, but concluded that they're probably not very likely options for Sacramento County right now. Several of them tend to involve a level of politics that just don't align with where we're at right now. For example, some Bay Area LEMSAs have had an additional sales tax element that has funded some of those kinds of programs. Some have had a property assessment, and we just did not think that an electoral solution was probably going to work in our community at this time. So what it comes down to, and we've been very blunt with the Board of Supervisors, that this is likely to be a general fund issue. And it's going to be one of the hard choices that they're going to have to make. And we acknowledge that there are a lot of competing demands right now, and that it's not an easy time, but that nonetheless it was valid and worthwhile doing it.
Okay.
I think the presentation was well received and they got the message. And I'm optimistic about what we see in the proposed budget, but we'll see.
Well, that's great to hear, Jim. Thank you.
Yeah, nice to hear that. I apologize. We lost Annie. She was on, and so we do not have a quorum anymore.
Actually, once you convene a meeting and you have a quorum, I believe it lasts the duration. At least all the boards I've served on, that's how it has worked. I would imagine it's probably the same.
Really? Ah, I stand corrected. I'm certainly not an.
Far be it for me to tell you.
Oh, no, I'm not an expert in this. My question is, can we hold a vote without a quorum?
I just know from my experience in both nonprofit boards and and one county commission that once the quorum is established, it does not close, and you're able to conduct business.
Steve, our past chair. You
That was
feel
mine
comfortable?
as well.
Okay, I'm willing. to do that. All right. So with our remaining members, I'd like, is there anyone to put a motion forth that we vote on supporting the report and recommendation from the Emergency Medical Advisory Group to the Board of Supervisors? And that being that there needs to be funding for this program from the county.
I'll put that motion.
Thank you, Phil. Is there a second?
I would second it. This is Sanal.
Thank you, Sanal. Okay. So we've done this in two ways. We've entered our votes in the chat, and I would say let's try doing that again. Everybody in favor of the support for this program to the Board of Supervisors, please vote aye. And anybody not in favor, vote nay, and any abstentions, please enter those. Oh, I see. Did mine go to Chris? Okay, I'm sorry. Everyone. Okay. All right. I'm still waiting for one person. Let me find him. Okay, Joe Phil, way to go. Okay, it's unanimous. Everybody voted aye, and thank you.
Let me just say thank you for your support on this. I think your voice is an important element of this effort, and I appreciate your time and consideration. It really is appreciated.
Thank you, and you're welcome. We appreciate the opportunity to advise on this important issue. Obviously, we've heard about the emergency medical services in the past, and we understand the issues at hand. And so we're very pleased to support your recommendation.
Well, thank you so much.
We will send a letter to that effect.
Appreciate that. Farla, would you mind copying me on that? Just
Absolutely.
So we have the record. Thank you.
Absolutely. Okay.
I'm going to go ahead and bow out.
Thank you. Enjoy the rest of the day. Okay, so we can turn back to some of the issues we were just discussing earlier in terms of what we as PHAB want to do with the issues of correctional health that we've been dealing with and hearing about. So is there support for forming a working committee to address these issues, to first of all understand the issue, very complex with all of the moving parts and all the parties involved? So that would be the first purpose of the working committee, to understand all of it to the best of the committee's ability, and to report to PHAB on this, and to investigate, explore the concerns of the community in regard to the implementation of the practices and the data that they would presumably be interested in. I know PHAB would be interested in how well these programs are working, and where we can look at it and say, is there a better way, if there's something that can be facilitated in a different manner to help the programs that are already working and in place. Phil, hi. Do you have a comment on this?
Hi, yeah. So first off, I just wanted to say to Dr. Damiano, I thank you so much for all the updates and additional information. It's been super helpful in kind of, formulating all of this and kind of figuring out what's the best way to proceed. And also congratulations on the COVID numbers. I'm really glad that those are back down to good levels. So I guess my questions, like, primarily to Dr. Damiano, because I mean, I think, ideally this working group would, be a source of support and advocacy for kind of our shared goals of improving the health outcomes in the jail. And so, and I know that, you have many irons in the fire. You have championed a bunch of really great changes in a system that maybe is not as agile as we all would like, and obviously COVID made all of that worse. And so I guess my two questions are, one, what would you envision kind of the role of this committee or work group playing that would kind of support these efforts and be able to advocate for kind of advancing this shared goal that we have? And two, I think like the most concerning thing that has given me pause throughout this whole process is just the discrepancy between kind of the official reports and the reports that we received from the impacted community members, those kind of with lived experience of incarceration and those with loved ones who are incarcerated. And, it's especially, in situations like this, I think it's really important that we amplify the voices of those with the least systemic power and the most vulnerability. And so are there kind of mechanisms, I think in the community we have kind of patient satisfaction surveys and all of these things, which are, the bane of our existence in a lot of ways. But I think it's really important to make sure that we incorporate those voices. And so I'm just curious, are there mechanisms for community and also, people who are incarcerated, kind of their feedback? Because I got the sense that people felt pretty voiceless in this process. And I think that's one of my main goals, to kind of improve that dynamic. So.
Okay, thank you, Phil. That was a lot of information. So let me see if I can get it right. So right now we do have a process where we are reporting out, just like I said, to our Plaintiffs' Council, which is Disability Rights of California, and the Prison Law Office. They have expertise in people with disabilities, mental health, restricted housing, a lot of the things that the sheriff has oversight of. We have 2 medical experts and we have 2 mental health experts, one for mental health and one for suicide prevention. All of the experts have access to all of our materials. They have access to all of the charts and go into charts all the time. They also have access to incarcerated people. So, for example, when the PLO DRC was looking at the disabilities, ADA issues, they met with incarcerated inmates to get their concerns, to get their voices, and the same happens with some other folks. So that part does happen. So I'm not quite sure exactly this working group role. I'm happy to meet with them, talk about the consent decree, the work we're doing, things we've achieved, things we still need to achieve. We are all, I would say that for the people that work there, the leadership that works there, whether it's adult correctional health, our medical staff, mental health staff, we do believe in all the items in the consent decree and fully support those. It's a matter of doing the work it takes. Sometimes line staff won't always agree. Change is hard, especially layered change. The Sheriff's Department, they're separate from us. They have their own reporting structure. So I can't speak as fully about them, but they are also, generally I say are supportive of the change. You're right, there have been discrepancies, particularly during COVID. I think COVID has been this landscape of change that really took everyone, by surprise. I think what happens is as we rolled out COVID protocols, we were continually catching up and making fixes to our COVID protocols. So initially, we were doing the COVID, some of the things like individual reporting to the patients about their test results. I can't even remember when that phased in. But before, we would only report out if they had a confirmed case. But now it's everyone gets a report out. So as these changes occurred over time, that's where you're going to get some of these stories of discrepancies, right? And some of the changes with the sheriff's office, whether it was showers or masking, rolled out at their own pace from the sheriff's department. So you're correct on that. That's not anything I can fix. So that will happen. Other reports, I looked at some claims yesterday where someone had, I think they claimed they had some problems with COVID and they were not seen. But when we looked in the records, we saw how many health checks they had, how they said they had no symptoms, and yet on their claim or their complaint, they were complaining they had this. But when we looked at the record and what the patient said and what the medical staff assessed, it's different. That will also happen at times. I'm not talking about all the time, but that does happen. So I would hope, if we're going to do something like that, to not add to our burden. And I know PHAB has been extremely supportive of my programs in the past, whether it's been emergency medical services or our WIC clinics or our pharmacy, very supportive in the past, and I've appreciated that. If we're going to endeavor in this role, I would hope that part of the first mission would be some education about what is going on in the jails and what we're required to do and how that is rolling out before we get into all the specifics, because I'm always playing catch up otherwise. Does that help, Phil? I know that's a lot.
Yeah, no, that totally makes sense, and I know that this is a super dynamic thing, and I think my priority is just, you know, and now that these concerns have been raised kind of in this space, I think, you know, we need to make sure that we do our diligence and kind of ensure that these feedback mechanisms are in place, and that, you know, these quality improvement processes are robust, and we can see the kind of positive changes that we all want. So thanks for your response.
Can I pile on to Dr. Summers' comments, because I think he's expressed some things that I've been thinking about as well. This is Tina Slee, and I actually work in quality at UC Davis Medical Center. So I've been thinking about this a lot. And I'm certainly not here to cast aspersions on what Dr. Damiano has done with correctional health. This is such a huge job, and I know it's relatively new to her. I think this was a very nascent program in fiscal year 20, and then you were slammed with COVID, which probably made things feel very slow moving and maybe at times somewhat ineffectual, and it was just the nature of the beast. And thank you for kind of slogging through it the best you can. I'm trying, I guess, to draw analogies between how I view quality at the hospital versus how you might see it in the jail. And one of the things that I would be most interested in seeing, if it's developed, is a simple quality plan. And I sent Farla some comments about that. It might include things like your purpose and scope, your program design, staffing and oversight, your governance structure, performance standards for clinic staff, and approach to quality improvement when care gaps and safety concerns are identified. It's just kind of laying out your standard operating procedures in a way that kind of holds you accountable for how you do business, and it gives us some insight as to what your practice looks like. And I know it might be hard to achieve some kind of routine tracking and trending of quality metrics, but just to have kind of a start on that would be really helpful, and benchmarks if they're available, so that we can see if the jails are meeting our standards of medical care, or broadly construed standard of medical care in your setting. And lastly, it'd be good to know what kind of structural barriers and possible solutions are impacting the development of your quality program. And this is where I feel like we could advocate for you and build a true alliance. We're not here to be adversaries. The one thing that's it really stuck with me, that meeting in March, you know, when those members of the public came to speak, and they were so articulate and well organized and thoughtful in their comments. I can't let that go. And I am a public health professional myself. That's what my professional training is in. But I'm also a steward to the community in my role on the PHAB. And I feel that's very, very important. And I just want some way for us to have more knowledge and insight on your practices, and for the community through our public health advisory committee meetings to have some access to that information as well. I think we're reaching this stage in our development as a society where people are feeling very comfortable about pointing out the injustices they experience and holding one another accountable for improvements. And I think that might have, that might apply here as well. So those are some of my thoughts. I hope I'm not suggesting anything onerous. I think you're an incredible public health professional, and I want an alliance. I don't want, disagreement, or I don't want to be felt like I'm making unreasonable concerns. I want the alliance, and I want the accountability of the public. Thank you.
Okay, this is Sandy again. So our quality improvement program will not mirror a hospital's. UCD is a very large system. I am familiar with operating clinics in different programs. It will be different. Some of what you've mentioned, which you say is part of a quality improvement plan for us, those are elements that are in different parts of our policies and procedures. Not all of it's going to be in a quality improvement plan. So they're going to be different components depending on what kind of information is needed. Yeah.
Steve?
I spent about 10 years doing patient complaints at Kaiser for the internal medicine department. And I had lots and lots of work to do in that role. And I have to say, I'm very proud of my medical group from those days and the work that we were doing. And one thing I noticed is that official policy is one thing, but the ability of people who are taking patient complaints to communicate back to those who are lodging the complaints is something different. And Sandy, you mentioned that there are going to be these discrepancies. People make claims, and when you investigate them, you find out that the staff said one thing and the inmate is saying something else. And often I found, when I was viewing a very similar kind of situation when I was at Kaiser, that the real problem was just in the communication. A patient would come, in this case, a prisoner would go in to see the doctor with a complaint, and then go away feeling that there had not been adequate communication, didn't understand what's my diagnosis, what are they going to do for me, and a good job had not been done in communicating. And I've been studying this recently. I'm preparing a talk on the impact of racism on health and health care. And I'm finding that there is so much in the skill of, or in communications, in making somebody, a patient, feel comfortable that he or she has gotten appropriate care and attention and things are being done the right way. And I guess all I'm really saying is that your policies may say one thing, but implementation and having people who are empathic and good communicators and talking to the inmates is something else and may have to be looked at in a different fashion. So I just want to put that out as something to look at when you're analyzing your program.
Yes, so I would agree with you 100%, Steve, on that topic. It's hard when you roll out a new change. You'll find that it's, people do it in various different ways. We rolled out a policy on health service requests. We went back into the policy, had to revise it to make sure staff were directly communicating with them what was the nature of the health service request, what other issues they might discuss, to make sure that the communication is there with them. And that's just one policy, but we are doing that a lot. We do know a lot of it is in the delivery of the message. and staff really, this is a cultural change that's happening within the jail. I think all jails, just like when I ran the county indigent programs, they were used to having this kind of captured audience, so to speak, and really not thinking about it in the way that you and I would think when we work in the community. So we're trying to move them to that process right now, and that we do need to articulate that not only in our policy, but as we do chart reviews, as we hear patients' concerns, et cetera, to make sure that gets back. So that is a process that's ongoing, and you're very accurate about that.
Yeah, doctors need help with implicit bias.
Yes, concur.
And nurses.
Yeah. We all do. I think this is a very productive conversation. And I'm glad we have the space and time to hear these thoughts and suggestions and responses. My vision for this working committee is to help PHAB understand all this as we are responsible for being responsive to the public on these issues. The working committee, as I understand, and I will check with Rick Heyer, our counsel, to make sure, but it is a committee that can have public involvement. It has a maximum of 9 members, but the majority should be PHAB members, but I will check because I think it will be beneficial in many regards to have a voice from the community on the committee, at least a voice, if not more. So I will check on that. But and I repeat, and I heard you again, Sandy, it is for, the purpose of this committee would be for the education of PHAB so that we're not wasting anybody's time and we actually do understand as well as possible the scope of the issue and the players and the products and the policies, and to have these dialogues within the committee so that we can bring to the whole board more of an informed idea of what we can do to help facilitate improvements and help you in your job. I've often heard, the board actually listens to us. So if there is something that we can identify that would help, then that would be the best outcome for this committee. But I think it also would help in terms of the communication with the public. And as many of our members talked about that meeting in March, as Tina just mentioned, it was really awesome to have so many of the public participating, because we're not in an ivory tower. We need to understand what's going on out there, and the public voice is something that should be heard at all public meetings. And so it was wonderful. It was difficult for sure, but wonderful to hear. And I want to encourage that kind of involvement and participation. And I think the working committee would be a good kind of pipeline into the public, because we would hopefully get representatives from groups that have already talked to us about their concerns, and they're very well organized and maybe better educated in some regards, in some aspects of this issue than we are, for sure. So. Oh, Joe Phil, your hand's up. I'm sorry, I didn't see that.
Oh, it's okay, Chair Kaufman. I just wanted to, again, thank you everybody for this wonderful conversation, and thank you to Dr. Damiano for providing us feedback. And certainly, with the events from yesterday and with the events that's been kind of happening throughout the nation everywhere, I think it helps to have a good conversation of compassion, as well as just understanding that voices are being heard. So I really appreciate all of the different feedbacks. My only 2 cents here is, having come from the community side of things too, sometimes it just helps to have maybe some measurable goals or metrics or outcomes that we can kind of report to the public, whether quarterly or semi-annually, that could perhaps help shape the conversation. So whether there's like amount of feedback heard from the community or amount of nurses that have provided positive grades to the interaction, things like that, that could be, it doesn't even need to be like checks, or X's or zeros, but maybe like a bar that says, hey, we're working towards something that's measurable and its outcome and data specific that could potentially help these policy changes. I think that would be good for the community because at least they know that we're doing something. And I do sincerely believe that the county staff are working their best to really institute this cultural change, but also to be a little bit more accountable. And I do want to support the county staff at the work that they're doing because I know that they're doing an amazing job. It's just sometimes it's easy for a lot more folks that have already been fueled by other things and are angry about certain things to just kind of blame when we're trying to fix and hopefully get the both sides to agree. So that's my 2 cents, but I really appreciate you all setting this up and giving me a chance to speak.
Thank you, Joe Phil. Thank you for that. Okay, any other comments about this? Discussion points?
Carla, if you don't mind, just because I'm still new and trying to understand how all of this works, can you just practically lay out what the working committee would look like and how that connects back into PHAB?
That's a good question. I have not been on PHAB long enough to know about working committees in practice, but I do have the bylaws and it is one of our options. And in terms of what it would look like, well, I think that would evolve, but really it would be a group of people getting together, compiling the information that Sandy keeps providing us with in one area and really going through it to have a very vast and detailed understanding of what we are doing as a county in this regard and our measures, the policy changes, the implementation of these practices, what does that look like, and whatever data is available. So they would have the purview of looking at all of this, trying to make sense of how are we doing and where are we going. The issue of having the public component on the committee would provide us with input on areas where people are concerned that they're perhaps getting reports about certain practices that we could look and point to as, well, this is the policy and this is a practice. Let's see if there's anything there that we need to look into more detail in order to answer their questions or concerns. And then all of this would be brought back to the full PHAB board and we would be kept abreast of it. Anything that we could identify as being advantageous in terms of advising the Board of Supervisors, we could do as an outcome from this. So, but honestly, this is an idea that came into my mind very recently. And so it's not completely flushed out, but we can flesh it out.
Great.
But yes, Steve.
Let me just add, I think that there are fewer administrative requirements per bylaws for these kinds of ad hoc committees.
Yes.
So you don't post meeting dates. You're not required to post them publicly. You're not required to keep minutes, I believe, of the meetings, although you may choose to. So there are certain things that are not required as they are of PHAB.
And that's something I've been chatting about with different people over the last day, not quite. The problem with PHAB is the obligation that we have functioning under the Brown Act limits how much conversation occurs and the back and forth. The notices have to be posted in advance, 72 hours. So that makes it difficult to call quick meetings because the public needs to be kept abreast and advised of any of these meetings. as they are public, they have to have an opportunity to attend. So it makes it very cumbersome for us to be doing some of this work. So that's why, as Steve so correctly pointed out, my impetus for creating the committee is to make it more flexible, be able to be more responsive, to be able to speak to different parties and entities without having to post notices. So does that give you a better idea? Do you have more questions about this?
Yeah, that was super helpful. Thank you for clarifying. Just one more quick follow-up question, which is because I think there's a little bit of back and forth too on scope. So there, the meeting that we had previously was supposed to be focused on COVID-19, but got into bigger sort of compliance with the consent decree and even around decarceration. So what are you thinking for the scope of this committee, or would that sort of be what the committee or working group would figure out for itself?
I think it would be good to leave it open for now, because this is such a new concept that I'm just introducing. You're right. I think we moved from one place to another. And thank you, Jim, for attending. Just let me interrupt. I really appreciate your presence here. He has to leave, so. But I think the issue is that we started with a certain focus, and then we heard from the public, which expanded that into broader areas. And so I think that we need to be responsive about that. And I think the committee can look at this issue of what should we be looking at with this particular committee, the purview and the scope. I'm not going to set that right now. I think that it would be a good conversation for people who would want to serve on it to have. And maybe we would need another committee for a separate issue that's related, but you don't want to be too spread out and dilute your efforts if really it's the scope is so large that you couldn't accomplish very much. We wouldn't want that. So it's a good point to.
This is Sandy. If I could also weigh in that this would not include stuff from the sheriff's office, because they're a separate department. And the county, there's a variety of people that are doing a lot of efforts to decrease the jail population. If you wanted discussion of those, we would need to invite someone else into the meeting with us, which we could do. We do have people that have that, and they've had several board presentations on these alternatives, and they're actually doing another consultant piece to help with that again, to look at the efforts.
Yeah, thank you for that. Yeah, for sure. That we also as a board could continue to look at this and as a board invite some of the participants in these various areas. That's been something on my mind. The DA's office or other entities to explain some of the workings and the activities that are going on currently. So that's we do have the opportunity to have the whole board hear some of that at some point also. But it would be very advantageous for a working committee to have access to these people and to be able to have conversations around these issues. Okay, well, we're fast losing members. So I'm going to ask if do people have a sense that this would be a productive, a good idea, a doable idea to have a working committee? I don't know how many people would be willing to participate and serve on the committee, but before we go there, I just wanted some feedback.
I think this is a great idea. I think this is a super complex issue, and I think that I'm getting the sense that there is a quorum of us that would be interested in contributing, myself included, and I think this would be a really important thing to devote some effort to.
I likewise think it would be great. I think I'm still learning everything, but would love to join and support as I can.
Wonderful. So I'm glad to hear this. Obviously, I think the letter that has had a lot of effort from a number of people in crafting this has to be put to the side for the moment. I'm not comfortable sending it out right now as it stands, as it is written. It has very good points. I think it's helped us understand what we need to know and where to put our efforts. And in that, it's been very, very useful. But I'm going to suggest that we do not vote on it and that we use it as a guide for what we might want to look at in terms of the workings of the working committee. So is that something that people support? Yeah, okay.
One potential alternative suggestion is, I think we have, like you said, we've created a pretty good template, and I think created a lot of shared understanding by kind of drafting this letter multiple times. And perhaps the letter could be modified kind of one last time, like announcing this working committee and some of our concerns. And maybe that would be a constructive way to, convey some of this process to the Board of Supervisors, and also kind of unify PHAB kind of around these shared concerns and kind of our plan of action, and maybe the kind of goals of this working committee, if we could flesh those out in broad terms. I don't know. Does that sound appropriate to everyone?
Farla, just a quick question. Sorry, I'm trying to eat lunch while I talk to you guys, so I don't want to show me eating. One thing that I think Christina and Steve, and you also, when we had our exec meeting earlier this week, really clearly, I thought was important that we also very strongly acknowledge the feedback we got from the public. And I think, to Phil's point, maybe part of that initial notice could sort of be a broad acknowledgement of what we learned, as just to kind of add to that. My only concern, as I think Christina also, again, really did a good job earlier of mentioning, is we want to make sure that people at least feel that they were heard and that we acted with good intentions upon what we heard from them. And I'm hoping, perhaps, if not for the letter, then this is the outcome of what we heard from you guys. You are the impetus, you are the reason for this change. So just kind of bringing us back to how important and significant that meeting was for all of us.
I appreciate that very much. Thank you, Sanal. Yeah, sorry, Phil.
I was just expressing my appreciation for that comment, that's all.
Yeah, I think that's really great. And perhaps after I check with Rick, we can understand, maybe it's sort of also an announcement, in a sense, that the public has the opportunity to sit on this committee. And that might be a good first step in that regard. Okay, well, I think this has been really a different kind of conversation at a PHAB meeting. I really like it. It allows for a lot of participation and exploration in more detail than what we usually have at our meetings. So I will venture to keep the agenda a little more open. Sometimes it produces a lot of dead air space, but perhaps these kinds of topics are ones that also stimulate a lot of participation. So that's a good thing. Sandy, I want to thank you so much again for your patience with PHAB as we walk through this process of how we do business and where we need to put our efforts. And also, we make your life harder, I think, in many times. I know you appreciate our support, but lately I think we've been maybe a little thorn in your side. So we'll venture to be more collaborative by keeping up to date more on our knowledge of the subject matter, and find ways of being educated and more supportive of your goals.
Thank you very much. I know it's hard to convey, especially in brief time, you know, all the different action plans we're working on. So it's challenging for everybody. So thank you.
So with that, I'll ask you if you think that you would like to bring to PHAB, have more time to present a broader and actually more detailed view of what's going on and all of these different practices and the policies that are there now and how they are being implemented. So the whole PHAB has some idea of what's going on, and that would launch the working group. So people could choose, oh yeah, I'm really interested in that. I'd like to be part of the working group. So again, it would be very broad and I said detailed, but of course you can only go into just so much detail, enough to give people a flavor of what's going on and a vision of where you're going and the progress that's been made. And maybe that's where we should start. Would you be willing to do that, Sandy? Do you think that's a good idea?
Yeah, right now I'm working, we're actually doing a huge presentation, getting stuff together for another meeting. So it would depend on what level of depth we'd need, because I probably have to prepare some materials for the group that has not been exposed to the information.
Okay, so maybe we can talk about that and how it would work offline.
Sure. Yeah.
Okay.
That'd be fine.
Okay. All right. So we will adjourn. We will take up the suggestion to revise the letter to the Board of Supervisors and acknowledging the public involvement and our role that we see it now in terms of further investigating the issue and helping correctional health move in the direction that that is advantageous to all in the county. Okay, so I will be in touch with the executive committee. And if anybody has any other suggestions, please don't hesitate to send them to me or give me a call. Thank you, everybody. This has been great.